Um, like many of our listeners, perhaps I've had patients who've used the word microdosing, something I don't quite understand in the world of psychedelics. To me, that's your placebo group. That's the 1 milligram it's worth. Can you share any insights with our listeners as to what if a patient says, "How about if I do this on my own with microdosing? Is that going to have a benefit, or what's that going to do?"
Well, this is an area that where I don't feel qualified to pontificate too much, but we use a single dose as a single microdose as a control treatment for our 25 milligram dose. And
That's
obviously
the
we're
milligram.
looking 25 milligrams. So we're looking to demonstrate a difference between 1 and 25. And that is what we have seen in our studies so far, a difference between 1 and 25. Now, that means that the 1 milligram is effectively a placebo. Um, there is there's a need, I think, for proper trials of microdosing if this is something that is going to be taken seriously by psychopharmacologists. And I think the problem is that where studies have been done carefully, it's usually looked like it's an expectation effect that people go in with high hopes for this treatment, they find reasons to change, and that's a perfectly fine, by the way. Any reason that makes you able to change bad habits and feel better about yourself is fine with me. But the idea that there's a specific sort of sub-threshold microdose pharmacology that is important and replicable as a pharmacological effect, I think so far we don't have any evidence that is correct. And I would add a further concern that I have is that self-medication with microdosing is often pretty uncertain about what the dose is, and it can become very chronic. And one of the things we know is that exposure to 5-HT agonists can have effects on cardiac function, which are pretty potentially negative. So one wants, and this is in the FDA guidance, that one has to look at, it's the 5-HT2B receptor for the
Mhm.
pharmacological nerds amongst us, but activation of that receptor chronically, even at low dose, potentially could be something that requires toxicity studies at the very least. So, I think it would be very irresponsible for doctors to advocate the use of these medications at even minimal levels of dose because I don't think we know that it's a completely safe thing to do.